Regarding the nerve, the motor cell bodies in anterior horn of the spinal cord cremator and the sensory cell bodies in the dorsal root ganglion. Regarding the nerve, it has cell body, it has dendrites, which are the extensions from the cell that receives input. Then you have axon, which conduct electrical signals via action potential. They can be myelinated fibers. These are covered by Schwann cells. They can be type of Schwann cells are myelinating Schwann cells and non-myelinating Schwann cells. In the CNS, Schwann cells are replaced by oligodendrocytes. Regarding a nerve, the outer covering is called epineurium, surrounding a group of vesicles to form peripheral nerve, protect against compression. Then is perineurium, surrounding group of axons to form fascicles, and this protect against stretch. And then is endoneurium, which surround individual axons and protect against stretch. So epineurium protect against compression, and the peri and endoneurium protect against stretch. The blood supply is extrinsic or intrinsic. The extrinsic blood supply is segmental vessels in the connective tissue surrounding the nerve trunk and form vasa nervosum, while the intrinsic vessels, longitudinally oriented vessels within the endoneurium with tight junctions between endothelial lining, and this provides a blood nerve barrier. Regarding nerve, conduction velocity is faster in 1. Myelinated axon, number 2. Large nerves, number 3. Upper limb more than lower limb, number 4. Proximal more than distal. It is reduced in number 1. Hypothermia, number 2. Extreme of ages, number 3. Demyelination condition like compressive pathologies. Normal resting potential is minus 70 millivolts. There is sodium potassium ATPase pump with sodium out and potassium in. For every 3 sodiums, 2 potassium gets in, and this creates a negative charge inside relative to outside. Normally, the nerve action potential, how it conducts. Normal resting potential is minus 70 millivolts due to ionic concentration inside outside the cell. This resting potential is kept by 4 important factors. One is lipid layer that is impermeable to water. Number 2, selective permeability. Number 3, sodium potassium pump. Number 4, Donan's equilibrium. The large organic molecules cannot enter the lipid bilayer. Whenever a threshold stimulus is applied, action potential will be created. When there is a sub-threshold stimulus applied, it will not produce action potential. There is something concept of summation potential. When the repetitive sub-threshold are given, initial response is created, and then the potential will be created. This is called summation potential. A stimulus which is strong enough to cross a threshold stimulus, that is minus 55, will start an action potential. When it starts, it will open voltage gated sodium channel, and sodium will go in. This will reach to the highest point of plus 30 millivolts, and at that time sodium channel will shut down and potassium channel will open in. This lead to loss of sodium and cause repolarization. The sodium channel anyhow are slow to shut down. Therefore, the nerve is always hyperpolarized and more into negative. Then the sodium potassium pump acts again and push him again to minus 70. There is 2 concepts, absolute refractive period and relative refractive period. The absolute refractive period simply is the time when the potential is going on, and the relative is the time when a stronger stimulus may be required. So what happens is, absolute refractive potential is a time in which another stimulus, if it comes in, will not lead to action potential. This is 1 to 2 milliseconds. This is called absolute refractive period. At this stage, as the sodium channels are open, there is no chance to activate more sodium channels. This happens at the peak of the action potential. Refractory action potential is the time when the stronger than normal stimulus is needed in order to elicit an action potential, and this is known as relative refractory period. This normally comes around the hyperpolarization phase. Regarding the type of nerve receptors, Meissner are mechanoreceptors. They can be, the nerve endings can be mechanoreceptors, thermoreceptor, or nociceptors. Thermoreceptors, temperature affected; nociceptors, pain affected. Mechanoreceptor can be light touch, Meissner; pressure or vibration, Pacini; vibration and stretch, Ruffini; and deep pressure, Merkel.